So what test can I do to check my kidney function? Okay, let me tell you some of the tests you could do to check your kidney functions and to know how healthy your kidneys are. Okay, number one is a blood test. Okay, under this blood test, you have what we call electrolyte urea creatinine. So what do you check here? You check for the levels of your electrolytes. The common electrolyte checked for are potassium, calcium, sodium, chloride, and magnesium. So if your kidneys are functioning properly and there are no other health issues, more often than not, this electrolyte test will come within the normal range. However, if there are problems with the kidney, you could have some rise in the level of your potassium called hyperkalemia, or sometimes hypokalemia, a reduction in the level of your potassium, or you could have a reduction in the level of your sodium called hyponatremia. And in some cases, when you have acute kidney injury, you could have a rise in the level of your magnesium. So that's electrolyte test under blood test. So the U part of the EU creatinine is called urea. So you can check for this urea in your blood. So it's often called the blood urea nitrogen test. You see, urea nitrogen is a waste product that should be filtered out of your blood by your kidneys. So in normal cases where your kidneys are functioning properly, your blood urea nitrogen should come back as normal. But when there is a problem with the kidney, the blood urea nitrogen is often elevated, increased. So the extent of the rise of this blood urea nitrogen could often indicate the level of damage the kidney or kidneys may be having. Still under the blood test, the creatinine part under the EU creatinine, you could check for the blood creatinine level. Like urea nitrogen, creatinine is also another waste product that the kidneys filter out of your blood and they are excreted through your urine. However, when there is a problem with the kidney or the kidneys, then the creatinine could accumulate in your blood. And then that's when you could have high creatinine level. But when your kidneys are functioning properly, your creatinine levels often come back as normal. Okay, so that's that about EU creatinine. It's a test you could do to check your kidney function. The second test under the blood test is called estimated glomerular filtration rate. I will call it EGFR for short. The EGFR value in people with healthy kidneys, well functioning, is supposed to be around 90 ml per minute and above. But an EGFR about 60 to 89 ml per minute is often accepted in elderly people around 60 years and above, and even in infants, because the EGFR tends to decrease with age. So if you are 60 years and above and your EGFR is around 60 to 89, it may be considered as normal, provided you do not have any other signs of kidney problems and none of your tests show sign of kidney